We begin tonight with some legitimately breaking news coming from the building right over my shoulder. Senate Democrats just emerged from a reportedly tense, closed-door meeting on health reform to announce that one of the cornerstones of their latest agreement is close to being ditched. Democratic Senator Max Baucus of Montana telling reporters tonight that the proposal to let people younger than 65 get Medicare is now likely to be out of the bill. The Medicare buy-in was what Senate liberals were expecting to get in exchange for giving up on the public option. The plan was to lower the eligibility age for the ever-popular Medicare program, allowing people aged 55 to 65 to pay to participate in it. Now, according to a number of Senate Democrats, that provision is out. Who's responsible? Most likely, it's, you guessed it, Senator Joe Lieberman of Connecticut. The way Senate liberals decided to compromise with Joe Lieberman when he said he wanted to kill the public option was to drop that public option in exchange for something that everybody knows Joe Lieberman supports: the expansion of Medicare. 9 years ago, Democratic vice presidential candidate Joe Lieberman sang the praises of the Medicare buy-in when he was stumping alongside Al Gore in places like Maine, where he talked to the Bangor Daily News, saying, quote, Lieberman said during the interview that the fastest growing group of uninsured are those 55 to 65. For that reason, the ticket, meaning Gore and Lieberman, proposes an expansion of Medicare to allow those and older to buy into the public program. That was 9 years ago. 3 years ago, in 2006, when he was being challenged from the left in a primary in his home state by Ned Lamont, Mr. Lieberman supported expanding Medicare then as well. 3 months ago, he talked about that campaign stance favorably when he was asked about it by the Connecticut Post. This video obtained from the Connecticut Post by reporter Greg Sargent today.
When it came to Medicare, I was very focused on a group post-50, maybe more like post-55, people who have retired early or unfortunately been laid off early, who lose their health insurance and they're too young to qualify for Medicare. And what I was proposing was that they have an option to buy into Medicare early, and again, on the premise that that would be less expensive.
An option to buy into Medicare. The Medicare buy-in is essentially a trademarked Joe Lieberman policy idea. It's an idea that he's promoted and explained and campaigned on repeatedly. Expand Medicare by allowing people younger than 65 to buy into it. This is the thing for which liberals were asked to trade away the public option. Get Joe Lieberman on board supporting health reform by killing the public option and replacing it with something Joe Lieberman likes: expanding Medicare. Surprise! Joe Lieberman's now against expanding Medicare all of a sudden. So against it, in fact, that he's not only going to vote no on any bill that expands Medicare, he promises to filibuster and block anyone else from voting on any bill that expands Medicare, which, don't forget, was his idea. And the more you look at the details of this, the worse and weirder it gets. Last week, when Senate Democrats announced they had reached a broad agreement and the idea of a Medicare buy-in was reported to be included in that, here was how Senator Lieberman responded.
Which way are you going to go on this?
Good to be here. Well, the direct answer is Joe doesn't know, because Joe doesn't know what's, nor do most other members of the Democratic caucus know what's in the compromise proposals that came out of the group of 10 senators that Senator Reid sent to the Congressional Budget Office. The announcement really is that I don't know how anybody can decide until you see the actual language of these compromise proposals.
Joe knows that Joe can't decide until he sees the Congressional Budget Office score. Senator Lieberman wasn't exactly warm to the compromise, but he at least committed to waiting to pass judgment on it until he knew what the financial costs of it would be. That was what he said on Thursday. 3 days later, on Sunday, Senator Lieberman decided even that didn't matter to him anymore. 3 days after saying he would wait to hear what the CBO said, after saying everyone should wait to see what the CBO said, he decided he didn't care what the CBO said. He was against it already, no matter what.
On one part of it, the so-called Medicare buy-in, the opposition to it has been growing as the week has gone on.
Well, what do you have to do that?
You got to take out the Medicare buy-in.
Got to take out the Medicare buy-in I have been proposing for years. Now, Mr. Lieberman is not only against his own trademarked health policy idea, he's not only not waiting for the CBO score that he once held up as a necessary precursor to any judgment on the bill. Senator Lieberman is now promising to kill the entire bill if that provision remains in it. And tonight, he appears to be winning. Again, said Mr. Lieberman a short time ago, and I quote, "Put me down tonight as encouraged about the direction these talks are going." Joining us now is Democratic Senator Ron Wyden of Oregon. He's a member of the Senate Finance Committee. Senator Wyden, it's good to see you. Thanks very much for coming in.
Thank you, Rachel.
I know it's uncomfortable for senators to sit through somebody else criticizing other senators, and so I realize this isn't the easiest discussion to have. But I have to ask you if what my take is on Senator Lieberman's position seems right to you. Am I getting any of this wrong?
Listen, it's obvious that he is looking at this proposal. He has mixed feelings about it, but this cake is far from baked. We are waiting now from the Congressional Budget Office, their positions. I think we ought to send a message to progressives all across the country. Let's keep fighting. We want to turn the tables on the insurance lobby. I've been working on this since before you were born. It's hard for me to admit it. I was co-director of the Great Panthers. Insurance companies were ripping people off then. They are still doing it. And Democrats in our caucus are going to stay at it until we get real reform.
Well, I know you were in the closed-door meeting tonight among Senate Democrats on Capitol Hill. Can you tell us about what the strategy is, either of the leadership or of the caucus as a whole, moving forward?
It was a very powerful session. Senators walked into that room knowing that folks at the grassroots level are counting on us. They're counting on us to really get health reform right. Single moms from Portland, Oregon to Portland, Maine, who go to bed at night in a cold sweat want to know, for example, that insurance companies can't cancel them if they get sick. They want to make sure that there's real competition, that there's real choice, that there's a way to hold those insurers accountable. I think it's the view of the caucus that what we need to do is lay a strong foundation, a foundation that we can build on in the years ahead. We are not going to get everything that we want in round one, but we're going to get a foundation that we can build on in the years ahead.
If what is passed, if what you can get done politically right now is no public option and no expansion of Medicare. So essentially, while private insurance will be reformed, Americans will be forced through the mandate to buy private insurance. If that is what can be done in round one, is there not a risk that Americans will be so aggravated by being forced to spend money in the private insurance industry, which we all feel is ripping us off, that there will be no political capital left to go back to the health reform well again?
We certainly have to do more to make coverage affordable. For example, I'm particularly concerned about the years before 2014 when the bill kicks in. So I've suggested that insurance premium fee, it's about $6.7 billion, it be adjusted. If insurance companies hold their premiums down, they wouldn't pay as much tax. If they don't, they'd pay more tax. So you bet we need to take additional steps to make coverage more affordable, to offer more choice. And Senator Reid made it clear tonight that he's open to good ideas that can help us get the votes we need to pass reform.
Is there going to be any competition for private health insurance companies?
We're going to make a start here. I believe that the proposal with the Office of Personnel Management, this is the proposal that's modeled after members of Congress. If we can make sure that folks across this country have a wide array of choices the way members of Congress do, and we can get folks into big groups with a lot of healthy people, so there's not the adverse selection that jacks up premiums, we can make a start, and start particularly with insurance reform.
I can tell the contrast between when you and I have talked about what's possible in health reform today versus what we've talked about in previous days. And I realize that there's still, to get anything, is still going to be a big public push from the Democrats. If what's possible right now has become so limited because of the opposition of conservatives within the Democratic caucus, does it make sense to use reconciliation, which would require only 51 votes, not 60, but would probably make the process take longer and would require it to be revisited in 5 years?
First of all, with reconciliation, you can't get any of the insurance reforms. Reconciliation deals with budget matters, so you can't get the protection for folks from pre-existing conditions. You can't protect them from cancellations. You can't even get the exchange exchanges up and running. Let's make sure folks know what we are going to get. We're going to get 30 million people covered. We're going to get these insurance reforms, lifetime limit protections. We're going to get a real foundation. I don't want people across the country, activists who've worked for months and months, to understand that we are getting everything that we have sought. But I think we are getting enough to say that this is a foundation, and we'll be able to send a message to those activists that their hard work has paid off.
Is there anything that's likely to pass that would go into effect in 2010?
Absolutely. I want to make sure, for example, that protection with respect to pre-existing conditions, that goes into effect. We're going to have at a minimum a reinsurance pool so that those protections get in place quickly.
Senator Ron Wyden, Democrat of Oregon, it's a real pleasure to talk to you about this. Thank you for coming in.
Thank you.